Hi, I'd like to go over a few things with you. General droplet and contact precautions when you're dealing with coronavirus. We're going to start head covering, cover your hair, keep something from settling in on it. Eye covering, goggles that protect around the eyes, or a face shield. At least a surgical mask, and mostly one of the huge benefits of a surgical mask is that it inhibits you from touching your face, which we all, as I just did, do constantly and mostly unconsciously. So we rub our eyes, we scratch our chin, we touch our faces. When I was in the Marine Corps, in boot camp, one of the things that the senior drill instructor would make a huge deal about was if you touched your face. He'd yell, scream in your face that Charlie just blew your face off because he saw you move, and he was training us to not unconsciously touch our faces. Now, you're not all going to go through boot camp to learn that. So a surgical mask is helpful in that regard, as far as protecting us from unconsciously touching our face. It is not good for aerosolized threats to health. So we'll get to that. Face shield, goggles, surgical mask, gloves. We'll talk about double gloving. Disposable gown. Foot coverings are controversial. They pose extra risk when you're taking them off, doffing them, donning and doffing. Donning is putting on, doffing is taking off. They pose a doffing risk, so the added protection that you can get from foot coverings might be offset by the added risk of taking them off. Double gloving. If you put clean gloves on before you put your gown on, put your arms through the sleeves, now you have a layer underneath the long sleeve on your gown, and then you put your second pair of gloves on over it. It creates a nice barrier there. It also gives you the added advantage of being able to take that outer layer off, have clean hands to get clean gloves to put back on, so that you're not just working with dirty hands all the time. Before you take the outer layer off, use some hand sanitizer, alcohol-based, and disinfect those gloves those outer ones that you have on. Take them off, dispose of them. That way, when you're reaching into the box of gloves, you're not putting a dirty hand into the box of gloves. And then you can put plain ones back on, go about what you're doing. You awake? So we talked about foot coverings, double gloves, surgical mask. Now, if you're dealing with a patient that is symptomatic for COVID, or you're having to do an aerosolized procedure such as a nebulizer, you're gonna want an N95 mask. PAPR device would be great, especially if you have a beard or facial hair, but they're not cost effective, especially in your setting. If you had one in the hospital setting that you could use, then that might be another thing. N95 mask. Ideally, they're going to be fit tested. Make sure that when, and if you've ever gone through that, then they put a hood on you, spray a nasty tasting or a sweet tasting aerosol into the hood, and have you talk while you have the mask on and see whether or not you break the seal. If you got a big head like me, it can be challenging. Even the biggest ones, sometimes you can break that seal. One thing that helps is losing the facial hair. Now, I liked my beard. I had a good looking beard. It took me 50 years before I grew it. But in this environment, it's wise to be able to give yourself a good seal with those N95 masks. So now, what do you do if you have to give a nebulizer? Well, some folks previewed this video and gave some good feedback, and I'm going to include some of that. One of the things that was discussed was doing it in the patient's home before you get them into the rig, if that is not going to compromise anybody's safety, the patient's safety. If they need to get, of course, you're an emergency crew. If you need to get them to the hospital right away, of course, giving them a much needed nebulizer may be improving their situation, and the trade-off is worth it. That's going to be a clinical judgment, and one that you'll be responsible for and have to answer for. I don't know what the ventilation is like on the ambulances, but if there's any way to increase ventilation and simulate a negative pressure environment, that would be ideal. That would be very helpful. A lot of places have gone to using meter dose inhalers instead of nebulizers, and they can be effective, but they're highly technique dependent. It doesn't help to just squirt one in the mouth. If it doesn't travel down into and deposit on the bronchial surfaces, you're just increasing side effects. You're not increasing efficacy. When, excuse me, when as a respiratory therapist, we would give meter dose inhalers for all kinds of circumstances. If I did not feel like it went into the patient's lungs, it just plastered on the back of their throat or their tongue, I didn't count that activation. It's not like a pill where as long as you can get it in down the gullet, you're okay. But it needs to go in, deposit on the lungs. So a spacer can be very helpful in reducing the amount of dependency on technique. And a mask connected to the spacer, such as we do with pediatrics, can also be helpful. But you're going to have to activate that, allow them to breathe several times to clear the chamber of the spacer. And it may take more than the standard 2 activations in order to be effective. In those circumstances where it's just not, there's a reason nebulized treatments exist. It's a much lower concentration, but it's over a longer period of time. Most of it is going out into the air, of course, but you're getting some deposited a little at a time, and it's not highly technique dependent. Now, that aerosolization can carry the virus if they're carrying the virus. So an N95 mask would be very important, and a good seal against a good clean shaven face would be very important. All right, I mentioned clean shaven, so let's talk about facial hair for a minute. For some people, that's very much part of your identity. Took me 50 years plus before I could grow a decent beard. And once I was able to, I liked it a lot. So, and now I have known people in the hospital setting to invest in their own papper because bearded, that was their identity. They were going to have a papper. And some people, you know, it was their PAPR. So I don't know many people that can do that, but if it's that important, then, and it's a matter of life and health, saving, protecting equipment, then that may be something that, you know, a person considers. But simplest thing is a dollar razor, and in the face of a respiratory borne virus, a good clean shaven face and a N95 mask. So those are things that you and your company and your family will have to work out.